Let's kick things off with a really common misconception that being competent in health and safety just means collecting certificates or ticking boxes. But there's way more to it, right?
Absolutely, and I see this all the time. True competence is a blend of knowledge, hands-on skills, practical experience, and even attitude. For example, someone might ace a training quiz but freeze up in a real emergency because they've never practiced the scenario.
That's such a good point. There's that legal and moral duty. Two organizations have to make sure people can actually work safely, not just pass a course. It's about real-world risk management, not paperwork.
Exactly. And when you think about it, competence is actually about building a culture where people feel equipped and supported. If someone's just memorizing procedures, but not understanding why they matter, the whole system's at risk.
That reminds me one of the trickiest parts can be figuring out where the gaps actually are. How do you spot when someone, or even a whole team, needs extra support?
It takes a bit of detective work. You've got to look at risk assessments, job descriptions, incident reports, even just day-to-day observations. I once found a gap just by reviewing a training matrix. Turns out, a whole shift missed fire safety training due to a scheduling mix-up.
Oof. That's the kind of thing that can slip through the cracks, isn't it? Early identification's key otherwise. You risk accidents, legal trouble, or even reputational damage before you know there's a problem.
Absolutely. And if you don't address those gaps, you not only put people in harm's way, but you start to erode trust. People notice when management overlooks something vital to their safety.
So once you've found the gaps, planning training is the next hurdle. But it's never one size fits all, is it? There are so many moving pieces.
That's so true. Budget, time, language barriers, even shift patterns can make it a logistical maze. I've helped teams blend classroom sessions with on-the-job mentoring. Sometimes a quick toolbox talk at the start of a shift can make all the difference.
And don't forget about tailoring for risk. You wouldn't train someone on working at heights with just an online module and a pat on the back. You need hands-on, practical training where the risks are higher.
That's such a good example. The most effective programs mix it up: some theory, a dose of practice, and plenty of feedback. It's all about making training stick, not just getting it over with.
Funny enough, even the best training can fade if you don't keep up with it. What do you see as the main ways to maintain competence over time?
Continuous professional development is huge. Think refresher courses, regular supervision, and just making sure people are actually applying what they've learned. I've seen skills drift when people stop getting feedback or when procedures change quietly behind the scenes.
That reminds me of a client who brought in new machinery, but only gave staff a quick demo, no formal assessment or follow-up. Within weeks, there was a scary near miss.
Classic case. Any change, new process, law, team structure should trigger a review of competence needs. Otherwise, old habits might not fit the new risks, and people can end up out of their depth before anyone realizes.
Now, I want to dig into the role of leadership. I've noticed that when leaders genuinely champion competence, it changes the whole safety culture. What's your take?
It makes a massive difference. When leaders walk the talk, allocating resources for development, taking part in training, or just showing up for toolbox talks, people pay attention. It sends the message that competence matters, not just compliance.
And the flip side is so true. If leadership isn't invested, people spot that right away. I also love that modern competence isn't just about checking training attendance. Real proof comes from watching how safely and confidently people actually do their jobs.
Totally. Things like observation records, feedback, even how staff respond in unexpected situations, they all paint a fuller picture than any certificate ever could. That's what builds resilience and trust, both in teams and across the whole organization.
Let's wrap up by talking about learning from mistakes. Those real-life case studies where things slip through the net, what stands out to you?
Honestly, the same themes crop up again and again. Lack of structured assessment, relying on assumptions, skipping supervision, or not updating training after a change. Like in that care organization case, just assuming new hires are ready can have real consequences.
And when it comes out in an incident report, it's easy to see how a bit more upfront planning could have avoided a lot of pain literally and figuratively. Continuous review, feedback, and a willingness to adapt really are game changers.
Couldn't agree more. If you treat competence as a living, evolving thing, not just a checklist, you're on the road to a safer, healthier, and more resilient workplace.